The first thing a lady who starts to feel sick, has delayed periods, wants to know is if she's pregnant. And if she's pregnant, how long does the sickness last? Will it have an effect on the baby? What are the remedies that can be done? Are medicines safe? Should they be used? Should she consult a doctor? I'm Dr. Padmaja, Padmaja Clinic, Vijayawada, with 25 years of experience in this field of reproductive medicine and good pregnancy care. And in this video, I hope to give you information regarding this most common problem which almost 70 to 80% of pregnant women face, that is vomiting in pregnancy, otherwise called as a misnomer morning sickness. You're not alone in having this because most of the women have it. The good part is that it is a self-limiting condition where it usually passes away by the third month of pregnancy. Why does this occur? It occurs, the most common theory is that as a protective mechanism, because the baby consists of only very few cells now. These cells are actively dividing, growing, and this growing baby is very susceptible to damage by chemicals. That is why when there is such severe nausea and vomiting, women prefer to take bland food, and this food is unlikely to have any noxious chemicals that can affect and harm the baby's growth. The easiest and the most simple remedy is to not eat food with a lot of strong flavors and smells. Bland diet, eating small frequent meals, chewing well before eating, stopping before you're full helps a lot. And use of infused water like soaking orange, apple, or balsam, mint in the water, and that causes change in the taste of water, and some women can tolerate this very well. The most effective remedy is having ginger tea. Dried fruits also do help. Not all vomiting in pregnancy is only because of pregnancy. If it is associated with severe pain, you definitely need to have a checkup because there can be an ulcer in the stomach. If it is associated with loose motions, it can be an infection of the intestines. If there is a change in your urine color, it could be because of dehydration, but it could also be because of jaundice, liver infections. Sometimes we discover that women are diabetic only when they are pregnant and have severe vomitings. We also need to rule out abnormalities of the pancreas, gallbladder stones, and any other abnormality that can cause pain. So vomitings are normal, but not if they're associated with severe pain. You do need to have a doctor's visit if there is dehydration, you're not passing adequate urine, you're having constipation and having to strain, there is extreme weakness because dehydration and electrolyte imbalance and vitamin deficiencies can have dangerous effects on the liver and the kidney. Most of the food comes out in the vomit, but some amount of it is retained. So it is important not to stop eating totally because you need to take some nutrition for the baby. At this stage, in the first 2 months of pregnancy, the babies are extremely small. So whatever the mother eats, that nutritional supplementation is enough for the baby. They don't need any specific diet. So we recommend that you make sure that you take a balanced diet. Make sure that you have fruits. Fruit juices are not necessary. Exotic fruits are not necessary. Seasonal fruits, whatever is available is good enough. Make sure that you have dates. dry fruits, some amount of biscuits and rusks do help women. As soon as you get up from bed, if you're feeling very sick, before you start doing anything, eat something and then start. Very rarely, in around 1% of pregnant women, they have vomitings to such a severe degree that they get dehydrated and they start losing body weight. We call this hyperemesis. This needs a consultation. It needs blood tests and checking the urine and IV fluids and antiemetics and some amount of antacids, because otherwise they will be so sick that they will not be able to do their daily work or get about and feel good about pregnancy. The good part is that it passes away by the third month. Unfortunately, in 10%, vomitings persist till delivery. This sensation of nausea and vomiting does run in families, and for some people, it is recurrent. So I hope this video was helpful. You need to make sure that you consult a doctor. You can use medications, but medications need to be prescribed by the doctor. Not all medications are safe in pregnancy, so over-the-counter medications should not be used. Most of the medicines do not have side effects other than a little amount of drowsiness and constipation. And you can only be assured that this will pass away, and it is unlikely that it will harm your baby. Vomiting occurring late in pregnancy as a new event might not be normal. Early pregnancy is acceptable. Why we are worried in late pregnancy is because it might be the first symptom of having very high blood pressure, that is called preeclampsia, or liver damage called acute fatty liver of pregnancy, which can be extremely dangerous if not tackled in time. If you have any questions, do write them down in the comment box and I will get back to you. Wishing you all the best. Stay safe, stay healthy. This is Dr. Padmaja.